Well, everybody, let's get started. And we're going to start, of course, with our land acknowledgement to begin with. And the LifeMark Health Group team acknowledges that our work spans many territories and treaty areas, and that we are grateful for the traditional knowledge keepers and elders who are with us today, those who have gone before us, and the youth that inspire us. We recognize the land and the benefits it provides all of us, and we invite everyone to reflect on the past and present history in their particular geographic area, and for each of us to think about what we can do to work towards reconciliation. So thank you all for joining us this evening and spending some of your valuable summertime. Hopefully most of us has some nice weather and hanging out with us to learn more about your feet, our feet, the feet in general, and finding out if you can do more on your own. And we're going to share some of the knowledge that we have. I want to again, reiterate, if you haven't heard what Krista has shared, is that the chat is not live, but we are monitoring and answering questions through the question and answer box. So please go in there if you have any specific questions. And of course, this information is general information, and we won't be able to give individualized treatment recommendations or recommendations at all, but we're going to give you a lot of basic information for you to be able to start reflecting on what you're feeling or people that you know, and some great treatment recommendations. And if you need further treatment, we'll certainly share that at the end. So I'm going to introduce our panelists. I'm going to have to briefly introduce them because their bios are quite long. We have brought to you some very skilled folks today, and Heather and Nirali are also sharing their evening with us. And so Heather is a registered physiotherapist. She's also a certified pedorthist and a certified combined decongestive therapist, as well as a fitter for compression garments, mastectomy products, and spinal and soft goods. As a clinic director at LifeMark's physiotherapy and foot clinics in Oshawa and Bowmanville, Heather focuses on lymphatic system, lymphedema, and swelling conditions, and a broad scope of pedorthic foot care and orthotics, particularly for the lower extremity. And Nirali, she brings a modernized and diverse skill set to her role by utilizing acupuncture, dry needling, and IMS, concussion therapy, manual therapy, and soft tissue release, as well as CRIPS treatment in her practice. Nirali helps her patients reducing discomfort and improving from a variety of conditions. She has dedicated her practice to helping patients address health issues by combining her knowledge of the nervous system, pain management, and pelvic health. So these two ladies, like I said, their bio goes on and on, but rest assured, and you also likely read their bios when you registered. But we're going to start with the basics and make sure that we're all kind of on the same page. So Heather, can you tell us, what the plantar fascia is and what it does, please?
Certainly. Thank you, Andrea. So plantar fascia is very interesting. It's a thick connective tissue on the bottom of our foot, and it basically runs from the heel to the toes. And I like to think of the analogy of a bow and arrow. So if you think of the arch of the foot as the bow, and the string of the bow is essentially an analogy for the plantar fascia running from the toes to the heel. So if you think about putting the weight down on your foot as you would put tension on a bow, it stretches the plantar fascia, elongates it, and it would pull from the toe and the heel. And you can see in the picture here where there's some inflammation where the plantar fascia is pulled from the heel there. Now, the function of the plantar fascia essentially is to support the arch of the foot, and it also may act like a spring-like mechanism, and it helps us to raise the arch of the foot for an efficient propulsion or to help us push off during running, walking, and those types of activities. And one thing to note is the plantar fascia is not a muscle. It's not stretchy. It's actually very inelastic and tight.
Thank you. So I think that's a really good starting point to kind of understand, because we hear this word plantar fasciitis, the plantar fascia, and there's a lot of different images that might come to our minds. So thank you for kind of getting us off to the right place to start with. Now, Nirali, what about understanding plantar fasciitis. What is it, and how might we know if we actually have it?
Sure. So the fascia, when subjected to tension and stress, can experience tiny tears. These repetitive micro tears have the potential to irritate or inflame the fascia, although the exact cause of the plantar fasciitis remains unclear in many cases. But this condition typically develops gradually, resulting in localized and the sharp pain in the bottom of the foot. The pain is most intense during the first few steps in the morning after waking up, or also after the prolonged periods of the standing and after the transitioning from seated to standing position. As you begin to move and walk, the pain usually subsides, but it may resurface after the extended period of standing or when transitioning from sitting to standing. Understanding the underlying cause of the plantar fasciitis is very important in order to prevent its reoccurrence. It's not solely a matter of inflammation, rather, it involves mechanical breakdown that necessitates the physical interventions, such as stretching and strengthening of the ligaments and muscles of the foot. As Heather illustrated with bow analogy, envision, envision the plantar fascia as the string on that bow. Any increase in usage or heightened force on that foot, whether due to the excessive weight or accidental impact, can result in partial tears occurring at the weakest point where the plantar fascia attached to the heel. Consequently, this leads to the development of the pain and swelling, which are the dreaded manifestation of the plantar fasciitis.
Great. So, I think when we hear itis at the end of any word, we often think swelling, right? That's kind of the term that refers to swelling. But the plantar fasciitis is different. As you said, it's not just swelling. It's actually some small tears and different levels of trauma that can occur when there's that excess strain on it. And now that I think we have a little bit better understanding of some of these different things, pain right when you first get out of bed or as you first stand up from rest. You did mention a few things that contribute to developing the plantar fasciitis, but are there certain things that put us more at risk for developing conditions over others? What were some of those things might be?
Yeah, so there are the risk factors that definitely I can discuss today. So first thing is age. So we see plantar fasciitis more common in age of 40 and 60. The reason is as we age, our tissues become less elastic and more rigid and less adaptable. So that puts at more risk of the plantar fasciitis. Another thing is that plantar fascia is affected by what's around it and other structure that can contribute to the force or the shock absorption of the foot, such as core muscles, your hip muscles, muscles of the knee. So if you have imbalance of this muscle, like if your muscles are weak or tight, it can also lead to the plantar fasciitis. Certain type of exercises we can also talk about, such as if someone is participating in prolonged running, ballet dancing, aerobic dance, this all can make contribute to the onset of the plantar fasciitis. Other thing I would like to talk about is the foot mechanics. So if someone has a flat feet, high arch, or even atypical pattern of the walking can affect the way why the weight is distributed and how the weight is distributed when you are standing and can lead to the plantar fasciitis. Obesity. Excess amount of the weight can also put excess stress on your feet and your plantar fascia. Occupations, certain occupations, so such as factory workers, teachers, and others who spend most of their work hours in the standing position, that can also lead to the condition like plantar fasciitis. And last thing is the footwear. If you have, if your footwear does not offer enough support, or it's not sufficient support there, or if they are worn out or ill-fitted, then it can lead to the plantar fasciitis. So these are some of the most common risk factors that we see in our day-to-day practice.
Great, thank you. So what I'm hearing is there's some things that we can control, but there is a lot of different small factors that can contribute to whether we get that. Age we can't control, if we have a job that we have a lot of standing to do, and being aware of things like our footwear and the different conditions that can affect what's happening at our feet. If you remember that picture of the foot or that model that Heather held up, there are a lot of different bones that affect and can move well and cannot move well, and muscles that can be strong and not be strong. So there is many, many factors, and it's often a combination of these factors that can end up leading to developing this plantar fasciitis. So if you have developed it, or for certainly some of these things that we're saying, you're relating to saying, yeah, when I first get up, I really do have that heel pain, and what are the things that I can do about it? Heather, maybe you can walk us through some of the things that we can do on our own to try to help get this pain and dysfunction under control.
Certainly, Andrea. Definitely, there are things we can try to manage this. So right away at home, you can apply cold packs. And the purpose of the cold pack is to reduce the pain and to reduce inflammation. So ideally, you're going to select a soft gel pack, a cold pack. And ideally, if you can wrap it in a thin, damp towel, and then you would apply it directly to the area of pain, usually under the heel or the arch. And general guidelines are for about 15 minutes. And if you can repeat that throughout the day, even 3 or 4 times when it's acute, you may get some relief. Of course, be cautious if you have any circulatory problems or sensory problems, and follow the directions on the package, and be cautious with the cold. Now, the other thing you could try to apply cold as well, that's pretty practical, is just simply freeze a water bottle, okay? And it makes a nice roller. So even in sitting, when you get home and you're too tired to think very much, you can just roll the water bottle under your foot, also to cool it, to calm the pain and the inflammation. And next level up along that line is to try contrast baths. So this is where you're alternating putting your foot into warm water for about 3 minutes and then into cool water for about 1 minute. And you can repeat several cycles of that. And the purpose of that is to really get those blood vessels dilating and then constricting and dilating and constricting, to get a nice flushing effect out of the area, to move inflammatory byproducts out of the way and also ease the pain and move the swelling. So also another way on that topic, another way to help move swelling is to consider a compression sock. So here's a leg here for you. And a compression sock can also help with to prevent swelling in some cases, and also to reduce the swelling and to move the inflammatory byproducts into the circulatory system back up the leg. Now, these socks, they generally can be found at pharmacies, and you can be specially fit for higher levels of compression at several clinics. And they do need to be at least the length up to your knee, because your calf muscle is the main pump to pump blood back up towards our heart, and to also move inflammatory byproducts back into the system to get filtered out. So that's something else you could consider. Now, we know, as Nirali spoke about, the bow effect of the foot and the arch of the foot. If the arch keeps being stretched, we're going to keep pulling the fascia, and it won't get a chance to heal. So just to get a little ahead of it when it's still sore, you could simply try an over-the-counter insole. So the advantage of this is they're readily available. You just generally buy them based on your shoe size, and they can be moved from shoe to shoe. So just a simple insert, and you can see the arch on that insole comes up and it supports the arch of the foot. So it's going to keep you from stretching the fascia and let it get ahead to start to heal. And generally, if you're picking one of those insoles, just pick something that's a little more what we call semi-rigid. There are insoles that are for padding, they're cushioned. And the thing with this insole, looks like it has quite an arch, but when you get your weight on there, it's a soft material. So it may not be quite as supportive. Still provides some cushioning, but not as supportive as a semi-rigid insole. You can also use what you might call a spike ball to massage the bottom of your foot. So these look like spiky balls, and they're not really rigid. They're a soft plastic, But you could sit just like you were rolling the water bottle under your foot. You could roll that under the bottom of the foot, and it will give a massaging effect to bring circulation to the area, which helps break down some of the scar tissue and adhesions, and it provides a massaging effect to also help with the pain and inflammation. And some of these devices you can buy, you can actually put them into the fridge or into the freezer, so you get a little bit of coolness as well. And you want to keep the tissues moving. So we want to consider also, moving and keeping up our exercise routine for many reasons and circulation, but it's a good idea to modify the impact. So if you are doing any high impact activities like running, anything with bounding or jumping, it's a good idea to try to maybe cross train, maybe pick swimming or pick cycling, or consult with your therapist about what other kinds of activity I could do while the plantar fascia is healing. And another way to keep the fascia supple and moving and from adhering is to do some stretching. And Nirali pointed this out, that we do need to stretch for plantar fasciitis, and it may even be a risk factor having tight calves to developing plantar fasciitis. So stretching routine. Oh, here's some great stretches. Thank you, Andrea. So it's showing the gentleman there on the left. He's stretching his calf by gently using that band to pull his foot up into what we call dorsiflexion. And as he does that, you could try that at home right now. You can feel that your Achilles tendon in your calf in the back tighten. And so he's doing it non-weight bearing. You can also do these stretches standing up. So the lady on the right, she's in standing and she's stretching the back leg. So the back leg, you can see her ankle, it would be her toes are pulled more towards her calf, and it's putting a gentle stretch on the Achilles tendon and the calf to stretch that out. And it's also stretching a little bit into the foot, into the fascia. And these stretching, generally, you can get advice from your physiotherapist or therapist. And generally, we want to do stretches when we're warm. So you would ideally do these after a bath or shower, after you've been active, you're warmer, at the end of your exercise routine. Okay, so I think those are, some simple things you can do yourself right away and try on your own if you think, you might have plantar fasciitis, and you may get some results right away and some relief.
Great. And I think those are things, it's you don't want to kind of throw everything at it. Think about what risk factors you might have fallen into, or the activities or the footwear that may have led to experiencing some of this foot pain. And those are the things that you might want to address first, right? If you've started a new training program, you want to do a 5K or you want to do a marathon, and you start to develop this, look at, what do my shoes look like? What does the pathway look like? What does the road look like that I'm doing? Am I always going, like I'm training on a track and I'm always going the same direction? So you want to make sure you do approach it with that cross training type effect. And it's a small structure that has to move our entire body. So weight management, knowing what is your ideal body weight, is that affecting it, can be a risk factor as well. So thinking about all of those things, we would certainly suggest you try some of these and see if you can get it under control. The sooner you start to change things, when you first start to experience any of this pain or discomfort, the better chance you're going to be able to have it affect you for the least amount of time. Plantar fasciitis has this ability to kind of be a nagging, ongoing problem because it's really hard to get off our feet, right? Like, we have to get up and move around. We have to get up and go to the washroom. We have to, move from place to place. So rest is always kind of relative when we talk about that. So using these insoles and footwear is really key to still allow us to move without continually aggravating it and giving it some extra support. But there's going to be times, certainly I know in my practice, and these ladies make a career out of helping people with foot problems, that you may need to seek further help. If this isn't working over the next few weeks of self-intervention, certainly your healthcare practitioner, like these physiotherapists, can help. And Nirali, do you want to maybe talk a little bit about what you can expect if you do seek help from a physiotherapist?
For sure. So the first step is is very, very important is an assessment. So we would like to then do a full assessment of the person who is having plantar fasciitis. During the assessment, we look we check for the ankle range of motion, mobility, strength. We want to also look at their hips, core, lower back, and hip, and the knees. Based on the findings of assessment, we customize their treatment plan. Usually the treatment plan involves the exercises, customized exercise program, which is not just, we are just not focusing on the foot now, we are focusing on some proprioceptive training. Proprioceptors are the receptors which are located in your joints. We send signal to the brain about the positions and, stability. It's very, very important for the stability. So we do then proprioceptor training, balance training, stretching, strengthening, as Heather mentioned about those stretches, and some other stretches that we can add, work specific training. Also, we would look at the activity modification. If the person is standing too much at the work, then we would give some stretches that they can use in between the work. We can also look for other type of modification that can be, brought on with some of these exercises. Then soft tissue techniques is very, very popular in the plantar fasciitis treatment plan. So soft tissue can help to break down some of the scar tissue, as well as it can help to bring some more mobility on those in that fascia, which cannot sometimes be possible by just stretching only. So the soft tissue techniques can help us over there. Then also the extracorporeal shockwave therapy. This machine is amazing when it works. So the sound waves are directed at the area of the heel pain that helps to stimulate the healing. This is more recommended for the chronic plantar fasciitis that hasn't responded to other conservative treatments. Some studies show the promising results. However, this therapy hasn't shown to be very effective. And then last thing that I use in my practice is acupuncture, which is again very helpful because it helps to increase the healing. It helps to increase the blood flow in that area. There are certain points that we use for the plantar fasciitis in the acupuncture, which has shown effective results. Yeah, so these are some of the common physiotherapy interventions that we use for the plantar fasciitis.
Wow. So there's a lot of different things that we can do. And thanks for sharing some of those things that you would try on different clients depending on their individualized needs. And I think that's one of the things that is important to know, that, as I said, it can be a slow responder. It is a stubborn thing, this plantar fascia. And when you get plantar fasciitis, you have to have some patience and understand that, unfortunately, we haven't found the magic cure yet. But adding a few extra things on top of the treatment, and Heather, you are a physio and a pedorthist, so you have that extra level of specific foot biomechanic training. Can you talk to us a little bit more about some of the adjunct or additional things that you can do or can have done from a treatment perspective to help treat this plantar fasciitis?
Oh, certainly, Andrea. Thank you. And in addition to the treatments that Nirali was mentioning, some other things that your therapist may try might be some taping. And one of the types of taping we use is called low dye taping. And generally we use a stiff tape for that. So it looks similar to hockey tape, but please do not use the tape you use on your hockey stick. It's a very stiff tape, okay, not stretchable. It's a zinc oxide cloth tape, and it's applied directly to the skin, and it's applied tightly around the heel, up to the toes, under the foot, and then wrapped around to help support the arch of the foot. And the benefit of this type of taping is that it's going to help support the arch of the foot and stabilize the plantar fascia. So this can be done early on and to allow the healing. And the good thing about this is you can also be taught to do this at home. So you can be applying it and reapplying it as needed. So that's one type of taping you'll see called low dye taping for the plantar fascia. Another type of tape that we use is called kinesio tape. And you see the diagram on the right with the colored tape the purple and the blue. This is actually a stretchy tape, and it's breathable, and it's applied on the skin, and it works more at the surface, and it's through the skin that it works, and it's by stretching the skin. It can stimulate lymphatic collectors and circulation, and we can also apply it in different ways to alleviate pain. And again, the good thing about this tape, it's quite skin friendly and can often be left on for several days. And you can be taught how to do this at home, so you can apply it as needed. And a lot of the tapes, they're commonly available, and that's another type of taping that you can try. So, and if the taping works, especially the low dye taping, we know that supporting the arch of the foot is helping, and it's allowing the fascia to heal. So the next step may be to go to an insole, so that you know you don't have to tape the foot all the time. Of course, taping over time, the skin can get irritated, and it's a bit onerous, taking the time to tape each day or frequently. So then we looked at some over-the-counter insoles. So then you may go and also use an insole or in place of that. And if you find that the insole is also helping, it may be recommended for you that you consider sort of the Cadillac of the insoles, the custom orthotic. So custom orthotics are worn inside your shoes, and they're used to help control the biomechanics of the foot and help improve the alignment of the feet and to download pressure as well, for some of the reasons they're used. And custom orthotics are made generally from a cast of each of your feet, and this is what we call a plaster slipper cast. So a mold will be taken of each of your feet independently, because they could each be different and require different measures. And from the mold, a custom orthotic will be built for each foot, and certain features will be put in that to assist with your biomechanical problem. And they can all look very different. There's many features to an orthotic, so no two look the same, and no two even for both of your feet will be the same. And they can be moved from shoe to shoe. So, and as Nirali and both Andrea mentioned, footwear is extremely important. You need to have good footwear to house insoles or orthotics, and you just need good footwear in general. And it may be a risk factor, as Nirali mentioned, to developing plantar fasciitis. So general features you might look for in your shoe for plantar fasciitis: first of all, cushioning. You're going to go something to download that impact. So generally, trainers, running shoes, things like that, they're going to have a thick sole with cushion material to help dampen the impact force. It's also important that your foot is not slipping. You need to have a good fit, and this is where you might consult with one of your professionals to help get a really good fitting shoe. You don't want to have heel slippage, and you need to have adequate toe space as well and the proper width. And another thing is the width of the shoe. You can see this black sole here, it's quite wide. So if we have a stable base, it can also help download the impact and stabilize your foot. And also, we want to avoid things like really flat shoes and flip-flops. These are not good for the plantar fascia. They put it on a stretch and destabilize your foot. So try to avoid that type of sandal. A good slipper in the house could be an orthopedic sandal that you can slide your foot in and out that has a really good footbed built into it. So as Nirali said, when you first step up out in the morning out of bed, if you get that foot pain, it may prevent the arch from stretching. And another feature on your shoes is a little bit of toe spring. So this little bit of rock on the front of your shoe will de-stress the fascia, allow it to heal. So it's rolling instead of pulling your toe up and stretching the fascia. And other measures along that line are night splints. So these are devices that you can wear at rest or usually at bedtime when you're sleeping. And here's one here. There are different things out there, but this is a sample of one. So there are Velcro straps here that can flex the front of the foot up a little more. So you nest your foot in there, and you're in that position you were in when you were stretching, which puts a little tension on the plantar fascia, little tension on the calf. So at night, as things are healing, it's going to heal in a lengthened position, in a better position, so that it won't tear first thing in the morning, and we get a little bit ahead on the healing. Okay, so that's called a night splint. And there's a simple device that's also similar to a night splint that's actually a sock that you can wear. And you put your foot in, and there's a strap to pull your toe up. It may be easier if I just show a picture of it. Okay, so it looks like that. So you've got your foot in there. So you can wear that at night, and there's a little Velcro strap at the top here, and you can pull that up as much as is comfortable as your therapist tells you to adjust it and wear that at night also. And it's the addition of that toe flexing that is a little more specific to the fascia versus the calf stretching. So that's another item that we often recommend. So in summary, there are many interventions, as Andrea said, that you can try and that your physiotherapist may try with you as well to help with the plantar fasciitis. And as Nirali said, the PT is going to customize your program and look specifically at your case to try to provide the best strategies and approach. However, if we're not making progress or your plantar fasciitis is recurring, we work as part of a broader healthcare system. So we're going to help navigate and try to get you to other people that may be able to help. First of all, we may refer you back to your physician for further testing. So there are different conditions that can cause the heel pain. So perhaps you have a couple things going on or a different condition. So your physician may want to run some imaging, ultrasounds, MRI. They may want to prescribe some medications, some anti-inflammatories to help get this under control. Or they could refer you on to a specialist who may use some kinds of injections that will target the plantar fascia to help it to heal with some steroid injections or some platelet, the PRP, platelet-rich plasma treatments. And unfortunately, some people may even require a small surgery where a bit of the fascia has to be released in order to help it reset it and to help it to heal. So basically, as physiotherapists, as part of the health team, we're going to together try as many measures as we can think of. And if we've exhausted all of our conservative measures, then we're going to help you navigate the system to try to get the results you need. And ultimately, not just get relief, but to prevent it from recurring again so that you can carry on with all of your activities and the fun things that you like to do as well.
Yeah, absolutely. And, I think that prevention piece is really key. So if you remember some of those factors at the beginning that could put you at risk, anything that you can do to minimize that risk is really helpful. If you've ever experienced plantar fasciitis, you know you don't want to experience it again. So some of these preventative measures are relatively easy to implement so that you are less at risk, getting some flexibility in those calves. And that's a thing, our imbalances in strength and flexibility really tend to occur even more so because we can sit a lot. Many people now work from home, so they don't even have to, get out of the house and walk in. And it's those small things that allow us to stretch and create those balances that we have lost in some ways from being a little bit less active. So remember, if there's that whole saying about an ounce of prevention really does go a long way, because once you've had plantar fasciitis, you certainly are more at risk of having it again. So stay on top of it. Now, that's kind of the base of the information that we had. We certainly want you to throw some questions if you have extra questions in the chat. We've had a few here that I'm going to bring forward. And I'm going to start with a question for you, Heather. If you've had foot issues for some time and have orthotics and good shoes, should you see a physiotherapist or a pedorthist? Or a podiatrist instead? Who do you think is maybe the next best option there?
We all have our role in the care. So really, I don't think it matters who you see first. They will help to guide you, if they can't help, to the next best professional. I mean, as physiotherapists, we look at the whole body and the whole kinetic chain. So what's happening from head to toe. And something that could be happening up in your neck or shoulder could be affecting your feet, and something happening in your feet could be affecting up your body as well. So to help identify, these contributing issues, certainly a good physiotherapist, a physiotherapist is going to provide a really thorough scan of the body, your postures, joint flexibility, to give you a good starting point to, as Nirali said, some of the contributing factors, as well as to the primary problem, which is in your feet. And from there, your podiatrist or chiropodist is going to look more specifically at the orthotic device itself. So there's a lot of training as well that goes into making and providing and prescribing orthotics. So there's really specialties in that field as well. So, as global, if you start with the physiotherapist and get that scan, try to get to the root problem and the contributing factors, you could go from there, but follow up with regards to how the orthotic is helping to correct and mitigate those factors that are playing into it. Often there's a biomechanical reason for foot problems. So it's just getting to the root of the problem that will really is essential to try to target the problem, from many angles. So I think you've got a good start, but each of those professionals will all have something to contribute for plantar fasciitis.
Yeah, absolutely. And, I appreciate when you talked about orthotics and you talked about like custom orthotics are custom. They are different from foot to foot. They're different from one person to the next. So when you're at that level, don't expect them to be the same. And there's a lot of modifications and minor adjustments that your professional can really help to tweak it. If you're finding that the low-dye taping is helping a bit, but not quite enough, or the orthotic that you bought at the drugstore helps, but it isn't quite taking you there, you can certainly take it to that next level, that Cadillac of orthotics, as you said, which I really like. Now, one of the questions about orthotics, Heather's really asking, because I know there's a variety of methods that people will do to make a custom orthotic, right? Casting, scanning, and just wondering, is scanning because certainly that's become much more, I would say, common these days. Is it as effective as casting? And can you maybe just share a little bit of the contrast of those two?
Yes, both methods. The scanning is developing now, and it's coming to the forefront for many reasons and because of technology. So initially we didn't have scanning, so we would use a plaster slipper cast, and each method captures the three-dimensional aspect of your foot, and we need that to make an orthotic, not 2 dimensions but 3 dimensions. So that's essential. I can't comment on which is better. Generally, the plaster slipper cast was always considered the gold standard for casting. And the thing with the slipper cast, as well as being made, the therapist has the ability to work with the plaster, and you will refine the alignment, and we could mark different defects on the foot, etc. However, these things are also being now captured in the 3D scanning. I really can't say which is better. They're both being utilized. Certainly the technology is really coming along now that these images can be saved. So through time through the technology, they can even see how your foot is changing and compare one image to another.
Yeah, and there really certainly is becoming pretty advanced scanning. I mean, you could just think of a 3D printer, right? How amazing just a scan can interpret a lot of the information. I know we love, especially those of us who are a little old school, like I like to see something and feel something, but it's amazing the technology now and what you can do and see those 3D mock-ups and what have you. So there is a lot of advancement that has come around, and I think is still coming around, like you said, Heather. So Nirali, you talked a little bit about shockwave therapy. Could you remind me again, how effective is it in the treatment when using it for some foot pain and plantar fasciitis?
Sure. So shockwave therapy is like, as I say, they are sound waves. So when you
Nirali, could you move just a little closer to your microphone, please? You're a little quiet.
Okay. Can you hear me okay? Is it better? Sorry about that. So it's basically a sound wave. So when we do this shock wave on the plantar fascia, so it produces sound waves in that area, and it helps to stimulate the healing in that area. It breaks the adhesions and the scar tissue in that area, as well as it blocks the pain receptors and increase circulation to the injured ligament. So it creates the atmosphere for the healing in the plantar fascia. Shockwave. If someone is considering the shockwave therapy as a primary treatment, then it has to be done at least twice a week for 4 to 6 weeks. That's kind of recommendation. The treatment itself is not painful, but it can be a little uncomfortable. But most of the time, people feel better, like better right after the treatment, and they sometimes report that immediately the pain is 50% reduced.
That's great. Thank you so much. Now, there's always this question about bone spurs, and people are like, I need to get an X-ray and see if I've got a bone spur. Can you comment on bone spurs, and do they always come with plantar fasciitis? Do they have to be there? Can you have it without, etc.? Maybe we'll start with you, Nirali, and then Heather, you might jump in as well.
So bone spurs do not always come with the plantar fasciitis. They are both very different condition actually. Most of the time people have plantar fasciitis and they think that it's a bone spur. Bone spur is actually not as common as plantar fasciitis. And bone spur the pain of the bone spur can be different than the plantar fasciitis. Plantar fasciitis pain is, you see the first thing in the morning. The bone spur pain is more towards the end of the day where you are after the more activities. Plantar fasciitis pain is again due to the tight, the fascia, which is like after prolonged standing or prolonged sitting or prolonged standing, versus bone spur pain is not associated with any of those activities. So they are both different. They can occur both at the same time, but it's not necessarily related to each other.
Great, thank you. Heather, is there anything you want to add to that?
Yes, I think it's interesting. They used to think that the bone spur developed to take, as part of the inflammatory process, and it would take the tension off of the plantar fascia as this extension from the bone. However, in studies, they found people with heel spurs, bone spurs that had never had any pain or plantar fasciitis. So as Nirali said, they're maybe two separate things. They may concur, but it isn't a necessary feature of plantar fasciitis.
Fantastic. So I think that kind of wraps up the basic information that we wanted to share with you about what the plantar fascia is, what plantar fasciitis is, some of the risk factors, things that you can do at home. And really, it's that combination approach, what you do at home, what your professional has recommended for you, and a lot of patience and persistence to get through this and get back to all of the activities that you love to do. So don't ignore your foot pain. I think that for me is one of the key messages. And also don't think your foot pain always comes from your foot. As we heard, it can go anywhere from up the chain all the way down. You've got your whole body, and then your poor little foot has to try to accommodate for all of the shifts and imbalances that we have throughout. So I really wanted to thank you for your time again this evening, and hopefully you found some good information, or at least a start of some information to understand your foot a little bit more and the plantar fascia itself specifically. And certainly, if you feel like you want to reach out and you have more questions, you can contact a healthcare practitioner at LifeMark through many different things. We will pop up the different ways. You will have some connection in however you found out about this webinar, that you can go back to that Instagram, Facebook, LinkedIn. But one of the easiest ways is literally go to lifemark.ca, and there's a search box, and search either clinic, an area, or a professional specifically, to find out who's close to you and where you can get some more information. We're going to have the question and answer box open for a little bit here for any of those remaining questions that we haven't got to yet. But I would really like to thank Heather and Nirali for sharing some of their expertise with us and helping people understand their feet a little bit better, but as importantly, what they can do and change in their habits and themselves to try to combat this problem that will affect up to 10% of the the population throughout their life. So it's a problem that really can be debilitating when it stops you from doing what you want to do. So thank you very much, ladies. We really appreciate that. And of course, Krista working hard in the background, answering the questions and doing all the technical stuff. We very much appreciate that. Thank you all for your time this evening. And again, reach out in one of these ways that whatever works best for you. And we would be happy to help you if the self-care things aren't working for you. We'd be happy to take you to the next level to help you manage these things. Thanks a lot, everybody. We hope you have a great evening and good night. We will be posting the recording and you will get it in your inbox as a participant. So thank you again.